from forest cover and marine pollution to the behavior of wildlife, but most of all, of people. Me, you. After Hurricane Ivan, Caymanians discovered we are vulnerable to calamities we thought only happened elsewhere. We were reminded then, as we are being reminded now, that we are resilient. We are powerful. We are community-minded, Caymankind. For the people of the Cayman Islands, moments of crisis also present opportunity. We are the narrators. You are the catalyst for change. You are responsible. This is not just our pandemic story, but it is the story of how 3 tiny islands came together to change course in uncharted waters toward greater national solidarity, functionality, and pride. Me, you.
Hi, I'm Jade Parker. We understand that our government's new requirements to wear a homemade mask out into public spaces will be an adjustment for most of us. It's not something that we do every day. A homemade mask can help to prevent the spread of COVID-19 if worn correctly. Here are some tips to help make it easier. Masks should fit snugly but comfortably against the side of your face and be secured with ties or ear loops. You should be able to breathe through your mask, although you may find it a little hot because of your own warm breath. Keep the mask secured over your nose and mouth. Your nose should be fully covered. If it isn't, then your mask will not protect you. Avoid touching the front of the mask because this is where any contagious droplets may have landed. Instead, when taking the mask off and on or adjusting it, only touch the elasticated strings or the string around the top of your head. When removing the mask, put it on a clean surface that you will later disinfect. As an example, don't put the used mask on your kitchen counter while you wash and clean your groceries. For more tips and advice, please visit www.gov.ky/coronavirus.
Helping children cope during the pandemic is important. Remember to lead by example and take care of your own needs too. To support your child, listen and acknowledge their fears and questions. Provide clear information and be aware of your own reactions. Help children by creating new routines, limiting their exposure to media, and encouraging them to talk about what they've seen and heard. For free and confidential support, call the Mental Health Helpline at 1-800-534-6463.
The coronavirus has caused our most vulnerable to feel isolated and lonely. Due to their age and the probability of having underlying illnesses, our seniors rely on family and friends for comfort. You can help protect our elderly by sharing your love from a distance by following these helpful tips.
Remaining at home can lessen the possibility of contracting the virus and passing it on. Reach out to nursing homes or those in assisted care by sending homemade cards, artwork, or handwritten letters. Call your elderly family members often and stay on longer. Read a book or watch a show together while on the line. Gift books, games, craft supplies, a deck of cards, or maybe a puzzle to your elderly family members.
There are many resources that can help us care for our elderly. For a list of these, please visit www.gov.ky/coronavirus or call the Older Persons Helpline at 1-800-534-2222. We know you've been waiting to stop by. We know you've been hoping to have that birthday party. We know you've been wanting to hug your grandparents. And we know you've missed hanging out. Being kind and spending time with our loved ones is a part of who we are. But now we must rethink our social norms around leisure, around work, and around education. As we begin to reunite, remember we must continue to practice social distancing, proper hygiene measures, wearing your mask, shielding the vulnerable and elderly in our community. Remember, social distancing is came in kind. For the latest information, please visit www.exploregov.ky/coronavirus.
Are you a business owner? COVID-19 prevention is about more than just business as usual. Do you know what to do to ensure staff re-enter the workplace safely? Well, here are 7 helpful steps to guide you. Step 1. Conduct a risk assessment. Consider any operational and physical risks at your business and mitigate these before reopening. Step 2. Employ a health monitoring and safety management system. This ensures a safe working environment and minimizes risks of COVID-19 transmission. You can also designate staff members to act as safety officers. Step 3. Reduce physical interaction and ensure safe distancing. Require any staff who can to work from home. Require all meetings to be held virtually and require social distancing on premises and in vehicles. Step 4. Require personal protective equipment and good hygiene. Ensure a sufficient supply of masks for all staff and require frequent hand washing on site. Step 5. Ensure cleanliness. Require enhanced cleaning practices and always disinfect frequently shared supplies, spaces, and work vehicles. Step 6. Display reminders in the workplace. Ensure new safety measures are explained to employees before resuming work and display signs in key areas reminding of new protocols. Step 7. Perform health checks and manage potential cases. Conduct regular employee health checks and enable staff to stay at home if unwell or if they have been in close contact with someone who is sick. To learn more about re-entering the workplace, please visit www.exploregov.ky/workforce. Help support survivors of domestic violence by believing them. Being there for them is one of the best things that you can do. Listen and hear what they need. Let them tell their story in their own way. When supporting persons experiencing domestic violence, maintain confidentiality. They have trusted you enough to share their story. Don't share it with others. If children are involved, alert the multi-agency safeguarding hub. Being there for survivors also means staying in touch. Create a code word or emoji, so if you receive or hear that from them, you will call 911. To help them, it's vital to talk to survivors about their options and help them to evaluate each one. And finally, remember that you cannot rescue survivors of domestic violence, but you can support them on their own terms. For For additional support, please contact the Emergency Services, the Cayman Islands Crisis Centre, the Family Resource Centre, the Legal Befrienders Clinic, the Needs Assessment Unit in Grand Cayman or Cayman Brac, the Mental Health Helpline, the Kids Helpline, or the Department of Community Rehabilitation. COVID-19 pandemic is affecting everything from forest cover and marine pollution to the behavior of wildlife, but most of all, of people. Me, you. After Hurricane Ivan, Caymanians discovered we are vulnerable to calamities we thought only happened elsewhere. We were reminded then, as we are being reminded now, that we are resilient. We are powerful. We are community-minded, Caymankind. For the people of the Cayman Islands, moments of crisis also present opportunity. We are the narrators. You are the catalyst for change. We, you, are responsible. This is not just our pandemic story, but it is the story of how 3 tiny islands came together to change course in uncharted waters toward greater national solidarity, functionality, and pride. Me, you.
Hi, I'm Jade Parker. We understand that our government's new requirements to wear a homemade mask out into public spaces will be an adjustment for most of us. It's not something that we do every day. A homemade mask can help to prevent the spread of COVID-19 if worn correctly. Here are some tips to help make it easier. Masks should fit snugly but comfortably against the side of your face and be secured with ties or ear loops. You should be able to breathe through your mask, although you may find it a little hot because of your own warm breath. Keep the mask secured over your nose and mouth. Your nose should be fully covered. If it isn't, then your mask will not protect you. Avoid touching the front of the mask because this is where any contagious droplets may have landed. Instead, when taking the mask off and on or adjusting it, only touch the elasticated strings or the string around the top of your head. When removing the mask, put it on a clean surface that you will later disinfect. As an example, don't put the used mask on your kitchen counter while you wash and clean your groceries. For more tips and advice, please visit www.gov.ky/coronavirus.
Helping children cope during the pandemic is important. Remember to lead by example and take care of your own needs too. To support your child, listen and acknowledge their fears and questions. Provide clear information and be aware of your own reactions. Help children by creating new routines, limiting their exposure to media, and encouraging them to talk about what they've seen and heard. For free and confidential support, call the Mental Health Helpline at 1-800-534-64 63.
The coronavirus has caused our most vulnerable to feel isolated and lonely. Due to their age and the probability of having underlying illnesses, our seniors rely on family and friends for comfort. You can help protect our elderly by sharing your love from a distance by following these helpful tips.
Remaining at home can lessen the possibility of contracting the virus and passing it on. Reach out to nursing homes or those in assisted care by sending homemade cards, artwork, or handwritten letters. Call your elderly family members often and stay on longer. Read a book or watch a show together while on the line. Gift books, games, craft supplies, a deck of cards, or maybe a puzzle to your elderly family members.
There are many resources that can help us care for our elderly. For a list of these, please visit www.gov.ky/coronavirus or call the Older Persons Helpline at 1-800-534-2222. We know you've been waiting to stop by. We know you've been hoping to have that birthday party. We know you've been wanting to hug your grandparents. And we know you've missed hanging out. Being kind and spending time with our loved ones is a part of who we are. But now we must rethink our social norms around leisure, around work, and around education. As we begin to reunite, remember we must continue to practice social distancing, proper hygiene measures, wearing your mask, shielding the vulnerable and elderly in our community. Remember, social distancing is Cayman kind. For the latest information, please visit www.exploregov.ky/coronavirus.
Are you a business owner? COVID-19 prevention is about more than just business as usual. Do you know what to do to ensure staff re-enter the workplace safely? Well, here are 7 helpful steps to guide you. Step 1. Conduct a risk assessment. Consider any operational and physical risks at your business and mitigate these before reopening. Step 2. Employ a health monitoring and safety management system. This ensures a safe working environment and minimizes risks of COVID-19 transmission. You can also designate staff members to act as safety officers. Step 3. Reduce physical interaction and ensure safe distancing. Require any staff who can to work from home. Require all meetings to be held virtually and require social distancing on premises and in vehicles. Step 4. Require personal protective equipment and good hygiene. Ensure a sufficient supply of masks for all staff and require frequent hand washing on site. Step 5. Ensure cleanliness. Require enhanced cleaning practices and always disinfect frequently shared supplies, spaces, and work vehicles. Step 6. Display reminders in the workplace. Ensure new safety measures are explained to employees before resuming work and display signs in key areas reminding of new protocols. Step 7. Perform health checks and manage potential cases. Conduct regular employee health checks and enable staff to stay at home if unwell or if they have been in close contact with someone who is sick. To learn more about re-entering the workplace, please visit www.exploregov.ky/workforce. Help support survivors of domestic violence by believing them. Being there for them is one of the best things that you can do. Listen and hear what they need. Let them tell their story in their own way. When supporting persons experiencing domestic violence, maintain confidentiality. They have trusted you enough to share their story. Don't share it with others. If children are involved, alert the multi-agency safeguarding hub. Being there for survivors also means staying in touch. Create a code word or emoji, so if you receive or hear that from them, you will call 911. To help them, it's vital to talk to survivors about their options and help them to evaluate each one. And finally, remember that you cannot rescue survivors of domestic violence, but you can support them on their own terms. For additional support, please contact the Emergency Services, the Cayman Islands Crisis Centre, the Family Resource Centre, the Legal Befrienders Clinic, the Needs Assessment Unit in Grand Cayman or Cayman Brac, the Mental Health Helpline, the Kids Helpline, or the Department of Community Rehabilitation. The COVID-19 pandemic is affecting everything from forest cover and marine pollution to the behavior of wildlife, but most of all, of people. Me, you. After Hurricane Ivan, Caymanians discovered we are vulnerable to calamities we thought only happened elsewhere. We were reminded then, as we are being reminded now, that we are resilient. We are powerful. We are community-minded, Caymankind. For the people of the Cayman Islands, moments of crisis also present opportunity. We are the narrators. You are the catalyst for change. You are responsible. This is not just our pandemic story, but it is the story of how 3 tiny islands came together to change course in uncharted waters toward greater national solidarity, functionality, and pride. Me, you.
Hi, I'm Jade Parker. We understand that our government's new requirements to wear a homemade mask out into public spaces will be an adjustment for most of us. It's not something that we do every day. A homemade mask can help to prevent the spread of COVID-19 if worn correctly. Here are some tips to help make it easier. Masks should fit snugly but comfortably against the side of your face and be secured with ties or ear loops. You should be able to breathe through your mask, although you may find it a little hot because of your own warm breath. Keep the mask secured over your nose and mouth. Your nose should be fully covered. If it isn't, then your mask will not protect you. Avoid touching the front of the mask because this is where any contagious droplets may have landed. Instead, when taking the mask off and on or adjusting it, only touch the elasticated strings or the string around the top of your head. When removing the mask, put it on a clean surface that you will later disinfect. As an example, don't put the used mask on your kitchen counter while you wash and clean your groceries. For more tips and advice, please visit www.gov.ky/coronavirus.
Hi, everybody, and welcome to today's COVID-19 briefing. I'm April Cummings in today for Donna Bush. We want to thank all of you for joining us on all of our channels, including our audience at Radio Cayman. We begin with today's prayer. Pastor Ronaldo Drackett, President of the Cayman Islands Conference of Seventh-day Adventists.
Our God and our Heavenly Father, creator of the heavens and the earth, the sustainer of life, We praise you and recognize that it's by you that we move and we have our being. Oh God, I present the government of these Cayman Islands before you, asking that they will continue to allow you to direct their path. Thank you for your watch care over us over these past months in a special way, protecting our most vulnerables, providing for those who are in great need today because of this crisis. Thank you for moving upon the hearts of people in this community to give assistance during this pandemic. Our economy has been severely affected, but we will continue to trust you. We believe that just as you have provided for us in the past, you will continue to provide for us in the future. Help us not to forget your mercies extended to us as a people. We have begun the hurricane season, Lord. We ask for your protection in these challenging times. Dear God, please continue to watch over us, guiding our government as they make decisions to protect us in this pandemic. Please continue to protect all frontline workers and all the people of these islands. Please remember the countries that are terribly affected by this crisis at this time. We give you the praise and all the glory. In the name of Jesus Christ, our Lord, we pray. Amen.
Thank you, Pastor. Our panel today, His Excellency the Governor, Mr. Martin Roper, Premier the Honorable Alden McLaughlin, Health Minister the Honorable Dwayne Seymour. We also have with us in studio Chief Medical Officer Dr. John Lee, as well as Deputy Premier and Tourism Minister the Honorable Moses Kirkconnell. Joining us by Zoom is the local media, and we also have with us our sign language interpreter, Mrs. Carolyn Powell. We begin now with Chief Medical Officer Dr. John Lee.
Good afternoon. The results for today are that we have 274 negative tests to add to yesterday's total and no positives. That leaves our total positive count at 203 people, with no symptomatic people, 2 asymptomatic people, none admitted, and 200 having recovered from COVID disease. There are 137 people in government facilities being isolated and 5 in home isolation. And over the last 24 hours, there have been 7 calls to the flu hotline, none of which were actually related to respiratory symptoms. On that note, I thought I'd give you some very interesting figures, and the journalists may well have to replay this point of the tape in order to capture the information. But over the last 4 months, we've seen a considerable drop in the number of flu-like symptoms being reported to the Health Services Authority. So in March 2018 and 2019, we had around between 500 and 600 cases being reported, and in 2020, similarly, 553. In April, that figure in 2020 had dropped to half of the figure in 2018 and 2019. That trend continued, and in May we had half the number of people reporting with flu-like illnesses compared to 2018 and 2019. This figure has improved even more in June, where there were only a quarter of the people, 127 people reporting with flu-like illnesses to the HSA, compared to 2018 and 2019. The figures for 2018 and 2019 match very much the annual figures in that the symptoms are highest in the winter months, fall off somewhat during the summer months, and then rise again as we move into the next winter. But that considerable drop reflects all of the measures that we've put in place to suppress a respiratory illness. And it demonstrates so well how the distancing, the hand hygiene, the respiratory etiquette, and the wearing of masks can affect a respiratory illness. The really important point of this is that as we begin to consider and actually move to opening up the borders and allowing tourists back in, please continue to maintain all of the things that we've put in place to protect you, and the guidance that we've given you to protect you from the transmission of the respiratory illness, which is COVID-19 disease. I have some antibody results to report as well. The last time I reported those was 2 weeks ago. We have now screened 1,461 people, which represents around 2.2% of the population with antibody screening, of which around half were at Health City and half at the Health Services Authority. There are 49 who are positive, 36 of whom were known to be positive. They were previously PCR positive. And 6 of those 49 were contacts of previous positives. So even though we didn't pick them up with a PCR test, the antibody test has shown that they were exposed at the time of the known positives. Those 6 contacts may have been spouses or children, that sort of thing, but it's a very interesting figure to note, and one that was not surprising, really. 7 have no relevant history. In other words, they had not been picked up previously as being unwell. The people that have been screened are not representative, truly representative of the population, because around 50% of them are healthcare workers. The other 50% are largely from the community and first responders, and a very small fraction of them are chronic health, as we've been able to, for example, screen the people attending the dialysis units. The last thing I wanted to say today is that, and this is really more for healthcare providers than anyone else, is that testing restrictions relating to the testing of COVID-19 disease will be loosened somewhat imminently, in that I'm expecting to change my order regarding testing to allow anybody to undertake antibody testing, whether it be on island or off island, by whatever technique. I don't really feel that antibody testing is revealing that much information. We still wish to collect the information, but the information it's providing, we're not sure exactly how to use at the moment. But as I've mentioned before, with time that may well be refined better as the tests become better refined and our knowledge and understanding of how to interpret the tests improves. PCR and molecular testing will remain the preserve of public health, and the institutions who have been approved to take part in this testing going forward. Thank you, April.
Thank you very much, Dr. Lee. We go now to Reshma from the Cayman Compass. She has our first question for you, sir.
Thank you, April. Good afternoon, Dr. Lee. Thank you for
Reshma.
those figures. A lot there to process. My first question relates to the 2 cases that you say that you revealed today are, was it asymptomatic or symptomatic, did you say?
Asymptomatic. They're the 2 that have been reported. They have been asymptomatic for quite a few days now in the regular reports.
Yeah, I'm just curious about that, because we've had those 2 cases for for a little while now. We've been reporting 200 and then 203. So is this unusual for the asymptomatics to stay this period before being fully recovered, or it's totally natural?
You'll recall that we reported 2 positives, I think it was on Monday. So those are the 2 positives that are being reported as asymptomatic. They only were discovered on Saturday, I understand.
Okay, great, thanks. Now, the numbers that you shared with the antibody testing, you said that there are healthcare workers included. Dr. Williams sent out a release saying that the retesting of frontline workers have resumed. Is it that these are the same workers that are being tested in the rescreening process through antibody testing, or is it that you are doing a separate screening with the usual PCR testing that we've been doing?
Please see the 2 processes of PCR testing and antibody testing as separate, because we consider them as separate. They both provide very different bits of information. The antibody screening is more for interest and is probably not currently driving any policy decisions, as the antibody testing positive rate is so low. The PCR testing is what Dr. Williams was referring to, and he's suggesting that we're going back. We are on a continual program of going back to retest groups, and he was just reaffirming that we're going back again to retest the healthcare workers, as we have been doing for the prisons, the nursing homes, and the people at highest risk where we do not want transmission. We want to make sure we're aware if there's anybody positive that we do not want transmission to happen.
Okay, great. So then that brings me to my follow-up question. Are these retesting cases being reported along with the general screening program, or are you going to be doing that as a separate reporting structure for us?
They're reported as the results come through. Each time you test somebody, each time we go back to test somebody, we're testing them for a new reason to see if on that occasion they are positive, so they're being reported each time. So you're quite right. There are some healthcare workers who may find that their naves have been reported, I don't know, up to 5 or 6 times within the reports. And I think I gave a report through to Cayman News Service around a couple of weeks ago, where I described how there was a difference between the total number of tests that we've done and the number of individuals that we have actually tested. And I think that difference was something like 18,000 versus 21,000. I can't remember the exact figures.
Okay, so at the last briefing a couple of weeks ago, you had indicated, and I think the Premier as well had indicated, that you want people to come forward for screening, generally members of the public to put themselves forward for the screening. Have you had any sort of positive response from the public to that call to come forward for screening?
I don't know the individual results of. I can't answer that question. I'm not sure if Dr. Williams is on the call, but I'm not sure. I don't think he will be able to answer that question either. It's rather a detailed question. Anybody that wishes to come forward, people are reluctant to come forward, to be honest, at the moment, Reshma. I think a lot of people feel, quite rightly so, that the risk of infection from COVID is exceedingly low on the island, and I'm one of those people that believes that same fact, and therefore questioning why they would want to be retested. I think it's important for us to continue to do so in healthcare, just in case something pops up. But it will become much, much more important that we continue to resume the program when the borders open, when we will want to pick up anybody that's positive, particularly those on the front line. And we're thinking about ways that we can encourage people to come forward at that time to make sure that we maintain our vigilance at a very high level.
Okay, thank you, Dr. Lee. Just a final question from me. We've seen in the international media a lot of criticism in particular from the US president for organizations like the World Health Organization and the findings and their control of COVID-19. What sort of guidance or what sort of comment can you make on that when the public is seeing these comments and how they should, accept the information that is coming from entities like the World Health Organization?
Well, I might answer that question in a slightly different way, in the sense that it's very easy to criticize. And it's not always justified, but it depends who gets the platform as to how loud that criticism is heard. We are all learning about this pandemic, and there is no exceptions at all around the world. In the fullness of time, I think there will be analyses of the lessons we can learn from this pandemic. I don't really feel it's my place to be criticizing the WHO. I know that a lot of major public health organizations have given Cayman a tremendous amount of support in this regard. A lot of it's behind the scenes. You're not aware that I'm speaking to these people, that they're reaching out to us, that they're holding conferences, that in the middle of the night I pick up the phone and I speak to them about issues. But PAHO, CARPHA, Public Health England, and PAHO, as you know, is nearly synonymous with the World Health Organization, have at a country level given us an enormous amount of support, and I appreciate it very much.
Okay, great. Thank you so much, Dr. Lee.
Thank you.
Let's go now to Ralph from the Caymanian Times. Ralph?
Good afternoon, Dr. Lee, and thank you for your presentation. I have one brief question for you regarding testing. As we prepare for the open up of school, will teachers and support staff be tested on a regular basis?
A decision hasn't been made about regular. I think it would really depend on how it appears that any infection may be spreading. We hope very much, of course, we hope very much we will contain the spread, and that it will, if we have any spread, that we will be able to nip it in the bud quickly, that our systems that we will put in place and that we have put in place will work well, and follow. But it's uncharted waters. I think a lot of countries around the territory are finding they're in uncharted waters, and actually, unfortunately, finding themselves at the moment in places that they would prefer not to be. Nevertheless, they all have imperatives they need to follow. I'm sorry not to give you a more refined answer than that, and to leave it quite vague, but I don't know the answers to all of your questions at the minute about the future in that regard.
Thank you, Doc.
Now to,
Thank you, April.
Thank you very much, Ralph. Now to Wendy Ledger from CNS. Wendy, go ahead with your question for Dr. Lee. Hi, Wendy, can you hear us?
Yes, sure. Can you not hear me?
Not for a moment, but we hear you now.
Okay, sorry. Dr. Lee, good afternoon. Hope all's well. Just two quick questions, actually. One, you were wearing some kind of a device that was monitoring your temperature and everything. Have you learned anything yet about that you can share?
It's quite comfy.
Anything else?
And I've been told by the doctor that's been looking at the results that I'm very healthy. I think the most important thing that I've seen is how well it can monitor heart rate, respiratory rate, cough frequency, temperature on a continuous basis. It seems to perform very well. I don't know if you know, Wendy, but I took a week's break and I went up to Cayman Kai, and I was in and out of Starfish Point and in and out of a pool, in the sun, walking the dog, running, and not only did the thing stay where it was meant to stay and didn't fall off, I didn't have any problems with it. I thought the thing was dead, actually, because I didn't have to attend to it at all. But all of the while, it was providing information, and I was sent feedback reports from the company on this information, and it coped very well with all of the, I think, relative extremes, or the extremes, the sort of conditions you might expect a tourist to be in, because I was doing exactly that. It coped very well.
Okay. So it's obviously still under consideration as a possible tool.
Yes, and it's still on me as well, but yes, it's still sending its data.
Okay. The only other question I have is regards the two remaining asymptomatic patients who effectively were found out, you say, on Saturday. So that means that they probably contracted it sometime before that. So they're probably coming up towards getting a negative test. And then we'll have no active cases. So at what point would you feel comfortable saying that that's it? You know, Cayman's pretty much virus-free.
Interesting question. We keep getting positives that pop up. So, I mean, I think if we had several weeks went by that there were none, I would say so. But we do still keep getting positives pop up. And I understand that one of them was in a traveler. Nevertheless, the moment they hit Cayman soil, they become Cayman's responsibility to report to the WHO.
Right. So you would say that you want to go another couple of weeks.
Sorry, Wendy, I have actually
no active cases.
I have actually asked for us to be downgraded from clusters to sporadic.
Right.
And that's being considered. This is one of the functions that we work through the UK. So I've asked the UK IHR representative to consider, the representative for us for PAHO and the WHO to consider downgrading us to the next level, hopefully with a view to moving to none. But when we open our borders, I suspect that will not remain the case, because there will probably be one or two infections that pop up.
Okay. Probably be quite a lot more than one or two if we open the borders, I imagine. Okay, thank you very much for that, Dr. Lee.
Dr. Lee, thank you very much. Those are all the media questions at this stage. Let's go now to our panel. We begin with Premier the Honorable Alden McLaughlin. Sir?
Thank you, April. Hello, everyone. Happy Friday. It's been a long time, it seems. It's actually been 2 weeks since our last COVID-19 press briefing. And as Dr. Lee has indicated, we're happy to report that we've continued with our stated progress and are on track with our testing regime. I'm also very pleased that during the past 2 weeks, we've had only those 2 positive results, one of which was a traveler, and both are asymptomatic. Indeed, this progress is thanks to all of you, all of us here in Cayman, who have continued to play our respective part in maintaining social distance, continuing to wash our hands and wear our masks or cloth face coverings when out in public places where we can't adequately socially distance. As you're aware, we have been waiting at least 2 weeks between reopening phases to see what the effects have been of each reopening on the community and the incidence of COVID-19. Thankfully, we are in a very good place, I would say, probably the best place we've been in almost 4 months. And I'm comfortable moving forward with the easing of more of the regulations. The following changes will come into effect on Sunday, the 19th of July. From Sunday, 19th July, public meetings, the allowable number of persons will increase from 25 to 50. Managers or operators of restaurants or bars may permit customers to engage in dancing and karaoke, subject to appropriate social distancing. Nightclubs will be permitted to reopen with up to 50 patrons permitted at a time and subject always to the rules relating to social distancing, which might be somewhat difficult when you're talking about dancing, especially soca or soul music, we used to call it. Shisha or water pipes, known as hookah pipes as well, are absolutely prohibited given the public health risks of COVID-19 transmission associated with these and other similar devices. Weddings, from Sunday, weddings may have up to 50 persons in attendance, in addition to the bride, bridegroom, official witnesses, and the marriage officer. Funerals will also now be allowed to have up to 50 persons in attendance, in addition to the 6 pallbearers and essential mortuary staff and officiants. Persons will be able to visit residential care home facilities, for example, the Pines, providing they have had a negative PCR test within 3 days of visiting. We know residents of these homes are at the highest risk, so please maintain social distancing, wash your hands, and practice respiratory protocols. All contact sports will be permitted from Sunday, 19th July. Players and spectators will be treated as 2 separate groups or 2 separate bubbles because they inhabit 2 separate spaces. So we will be able to have up to 50 participants playing the sport and up to 50 spectators, providing those spectators maintain appropriate social distance. We have taken the advice of the Chief Medical Officer, who has carefully considered the request relating to the rental of scuba and snorkeling equipment, and he maintains that there are still significant public health risks associated with the rental of this type of equipment, and so there are no changes to the regulations at this time. Put another way, if you wish to scuba or snorkel, you need to use your own equipment. Persons who wish to travel by air between the islands will now be able to do so without having to take a test, providing they have been in the Cayman Islands for more than 2 weeks. In other words, on can go Cayman Brac without doing a test. Boating. Commercial boats will be able to carry up to 50% of their licensed capacity, not exceeding 50 people, providing social distancing is maintained. The gathering of boats will be able to take place now with up to 50 persons, and persons will be permitted to travel between the islands by boat for pleasure from Sunday. Restrictions still remain, though, with respect to access to Stingray City and the Sandbar, and only operators of commercial boats who have a Wildlife Interaction Zone license or a WIZ license will be permitted to access Stingray City and the Sandbar for the next little while. Access to Starfish Point and Rum Point remains prohibited for all vessels. I wish to explain the reasoning behind this. There's been a long-standing concern in the community about the way these areas of natural beauty have been managed. Government is taking this opportunity. That is the opportunity provided by the lockdown or restrictions on access to these areas, to consult with the Department of Environment as well as the Coast Guard and the Department of Commerce and Investment to discuss how management of these areas can be better monitored, better enforced, to provide a better experience for the wildlife, the residents of the area, and visitors. The current regulations will remain in effect until the 31st of August, 2020. So those are the changes, which, as I've indicated, will remain in effect from Sunday, the 19th of July, until the 31st of August, unless there's reason to make adjustments in the interim. Now I wish to provide a brief update on our support for small businesses. I am pleased to announce that the Cayman Islands Center for Business Development will open its doors to walk-in clients early next month. Since the launch of the government's relief measures for businesses in April, which is being managed by the center, 1,085 applications have been received under the Micro and Small Business Grant Program. $1,592,000 have so far been paid to applicants, with a further $386,000 approved for payment under the grant program. Of the 1,085 applications, 84% have been processed, with 347 business owners so far receiving full payment of $3,000. Based on the number of approved applications, the total funds so far committed by government is $3.147 million. The program currently has a 97% application approval rate. 73 applications with a total value of $2,451,000 have been received under the low-interest loan program. 11 of these have so far been approved, with another 7 currently being assessed for approval. The total value of loans at the approval stage is $615,000. For the benefit of those applicants who are unable to adequately present their financials to the bank, the government has implemented a technical assistance program where qualified accountants have been employed to help prepare these documents at no cost to the small business owners. So far, they have prepared financial statements and business plans for 42 loan applicants. Finally, I just want to say that it is a delight to have the Deputy Premier and Minister for Tourism back with us after 3 months of confinement in Cayman Brac, and we will have him with us during this presentation. I think everyone will want to listen very carefully to the government's plans for the phased reopening of our borders starting in September. And I think most people will be quite impressed by the degree of care and the great deal of thought that has gone on and that is going on with respect to how we can safely reopen these islands to business, to commercial business and tourism. Thank you.
Thank you, Mr. Premier. Now to His Excellency the Governor.
Thank you very much. Hello, everybody. It's good to be back with you again. I think the results do remain extremely encouraging, and I hope everybody welcomes the further relaxation of measures. Only 2 positives in July and over 3,000 tests, so that is a really good place to be. And we've now conducted an impressive 27,000 tests. So I think we can say again that the strategy of being followed by the Premier and his government is an outstanding success, and we're all determined to make sure that we maintain that. And we should all be thankful that we live in one of the safest places in the world just now. Sadly, that is not the case in other parts of the world, and particularly the US, 77,000 cases yesterday, a record, and there were many deaths, sadly, in Florida. And so my key message is really that we should not let our guard down. Our success shouldn't lead to a false sense of security. And we all need to continue with the social distancing, the basic hygiene, washing our hands regularly, and wearing masks in public places. And as we've said before, these are good practices that will keep us safe until a vaccine is developed, and they will protect our vulnerable and our elderly. And I thought the Chief Medical Officer's example of the drop in sort of respiratory illnesses from these very measures was a really important signal to all of us of how important they are. And I believe that our handling of this pandemic is already giving confidence internationally to Cayman's reputation and its good governance. And that will be a key element in our narrative in building back more strongly. But of course, locking down is easier than opening up. And the US situation does demand maximum caution on any reopening of our borders. But if we can get that right, cautious, gradual, phased, not rushed, we can avoid having to do what many others who have opened too quickly have had to do, being forced to lock back down again. And if we succeed, it will help build an even stronger narrative about Cayman as a successful, highly effective, and very well managed jurisdiction. In that context, I also very much welcome the work of the Reopening the Borders Committee, chaired by our excellent Deputy Premier. That's progressing really well, and I look forward to hearing the presentation shortly from the Deputy Premier. In the meantime, we continue to provide emergency travel options to a range of destinations, and I'm pleased to say at last we've made some good progress on Nicaragua, and I hope to get agreement to operate a flight to Managua very soon. There's also another flight to Manila via London on 28th of July. That will be full, and that's for Filipino nationals. And there's the further flight to London on the 31st of August, also for students and families. So that's all in good shape. And finally, on travel, I know that Travel Time are working very closely with Cayman Airways on additional flights to Jamaica, Canada, and Miami. I just want to say a quick word about the Cayman Regiment, particularly how we're managing the COVID risks. The Premier and I are working very closely together on the Cayman Regiment, and next Thursday we'll see the arrival of a Royal Air Force Voyager aircraft from the UK. This large aircraft will be bringing the training team, which will conduct the initial training for the regiment, and will also deliver the kit and the uniforms provided by the UK. The aircraft will only be here for a couple of hours, and the crew will remain airside. The training team has been in quarantine in the UK and will do a further period of quarantine in Cayman. They'll also be tested for COVID before leaving their base in the UK. So in consultation with Dr. Lee, we are taking absolutely no risks with that team. The recruitment for the regiment is going extremely well. We have our first 50 reservists identified, and the vast majority are Caymanians. They've been interviewed and have undertaken fitness tests, and the training course will commence on the 3rd of August and run for 2 weeks. Our 5 officer cadets have been doing really well at Sandhurst and are now in their final week of training. They're due to pass out or graduate next Thursday and will be returning to Cayman on one of the BA Airbridge flights. We can be very proud of how they performed and represented our islands on this prestigious course. So to Theo, Shanice, Jonassi, Halston and Gabby, we are very proud of what you have achieved. And then finally today, I'm sure everyone will join with me in wishing Her Royal Highness the Duke of Cornwall a very happy 73rd birthday. I think we all fondly recall the visit by the Prince of Wales and the Duchess of Cornwall here last year, which was a truly wonderful occasion. So many happy returns, the Duchess of Cornwall. Thank you.
Thank you, sir. Mr. Seymour?
Thank you, April. Good afternoon, everyone. Grand Cayman, Cayman Brac, and Little Cayman, and our Caymanian families overseas. Happy Friday to all. Thank you for tuning in. Governor, I can tell you that the Nicaraguans are very pleased with the way that the Cayman Islands is helping them and doing to assist. I've heard that personally.
Yeah.
This week has been 4 months, actually, since we shut down, and everything is still looking nicely here in the Cayman Islands. You must know we're proud of our achievements in keeping the people of the Cayman Islands safe and would not make any decisions that would jeopardize our hard work. That is why we have waited patiently before opening our borders and has maintained our testing programs and our quarantine measures. By now, in a regular year, most would have been on their long-awaited family vacation. And whilst you recognize this is unable to happen because the coronavirus is still rampant in so many countries, especially in the most favorite spot of Caymanians, the USA, we recognize that domestic economy will be much faster to recover. Domestic travel will be much faster to recover than international or business travel. This COVID-19 has affected us in ways that we didn't even imagine, and people and businesses are suffering beyond imagination. And we need everyone to work together in good spirit and harmony, that we come out of this pandemic with our dignity, the state or quality of being worthy of honor and respect, a sense of pride in oneself. Treating people with dignity means treating people the way you'd like to be treated. Dignity is one of the most important things to the human spirit. Scripture reading, Galatians 6:9-10. Let us not become weary in doing good, for at the proper time we will reap a harvest if we do not give up. Therefore, as we have opportunity, let us do good to all people, especially to those who belong to the family of believers. May the Lord add a blessing to the reading of his holy word. Shout out today goes to Ms. Pam Rocket. Happy birthday to you. And to Mr. Ivan, the Devil Farrington, 86 years young today. Happy birthday, Mr. Ivan. I want to give you an update from MRCU. I know that that's something that everyone wants to hear about. We've been working hard in ridding us of the nuisance mosquito problem. I live in Bordentown, so I am too very happy and pleased to report that MRCU has been diligently battling the existing biting population of mosquitoes across the country, as well as to contain mosquitoes' reproduction resulting from the weekend's rainfall and flooding. Both planes were active all week, spraying flooded areas containing mosquitoes' larvae, as well as spraying at night to reduce these biting mosquitoes. Likewise, all of MRCU's disease prevention officers have been actively treating smaller bodies of standing water throughout the island's neighborhoods. The DPOs have been out with the fogging trucks nightly to fill in areas not treated aerially and in response to any service requests. I would just like to add here that an additional truck will be out tonight in the area of Rum Point to Hotland tonight in response to a request. Trap count indicates spraying has been effective in reducing the biting mosquito populations, and I am pleased that requests for services are also trending down. So this is good news to the success in their hard work. MRCU does recognize, however, that there are still pockets of annoying mosquitoes, and they will continue their spraying efforts until they are eliminated. The entire MRCU team is to be commended for their ongoing efforts to suppress the mosquito population during this past week. In particular, the aerial team and the senior DPOs have continued to work tirelessly in their coordination of ground and aerial functions to achieve success. MRCU is also active on both sister islands, and teams that they are also being recognized for their hard work. Additionally, most persons should have seen by now the release of the public release to the public with regards to the health insurance premiums payment assistance program. I hope that this has helped to allay the fears surrounding coverage and payments of premiums. To reiterate, this ministry is now in receipt of invoices for the April and May premiums for the approved insurers. And these are currently being processed. The June numbers should be finalized shortly, as the deadline for applications was July 15th. Once these are finalized, payments will follow. There appears to have been some confusion surrounding the submission of invoices, but I'd like to ensure the public that the ministry's requirements in this regard are to ensure proper and transparent handling of public funds. During such an unprecedented time, it is fair to expect some glitches on both sides, and for those on our part, we apologize. However, I can promise that the hard work and dedication to fulfill this promise has remained a priority for the ministry and the HIC. In conclusion, I want to remind people that even though additional regulations are lifted this weekend, it is imperative we all follow the rules of social distancing, prevention measures of washing our hands frequently, sneeze and cough etiquette, and the using of hand sanitizers are applicable. As we look to international news, we are reminded this still is a real threat of COVID-19. A look at the resurgence in the southern states in the USA are stark reminders of this. Let us not become complacent. Please, I thank you, and God bless.
Thank you, Minister Seymour. At this stage, we're going to invite the Deputy Premier, the Honourable Moses Kirkconnell, to the panel. In the meantime, Your Excellency, if you wouldn't mind speaking just a little bit to the issue of personal responsibility, as well as personal responsibility outside at events where there are small crowds in place. How important is it for us to continue to follow the rules, even though we're getting more and more comfortable with things?
I think it's really important because, as we're about to hear from the Deputy Premier in terms of a phased reopening, these practices are what will keep us safe as we go into the next few months. So maintaining them is a good discipline to develop, and getting into the habit of doing it all the time, I just think is hugely important.
It can't hurt with regular flu prevention either, can it? All right, thank you, gentlemen. Now let's go to Minister Kirkconnell. Sir, thank you for joining us.
April, thank you very much. A very pleasant good afternoon to everyone. I want to thank the Premier and the Governor for their kind words, and I want to assure the Premier that both Minister O'Connor-Connolly and myself were working when we were in our constituencies, and we certainly learned how to use Zoom quite well. I want to do a couple things here this afternoon revolving around tourism, the economy, and opening our borders, and some housekeeping for some different programs we have in effect right now. The first one is the repatriation flights, and I want to let everyone know that we've added some repatriation flights because of demand. On July 24th, there will be 2 round trips to Miami. August 3rd, 1 round trip to Miami. August 14th, 2 round trips to Miami. August 24th, 1 round trip to Miami. And September 14th, 2 round trips. Jamaica, July 22nd, 1 round trip. August 12th, 1 round trip. And September 2nd, 1 round trip. These persons wishing to book the travel on these repatriation flights are asked to visit the Travel Time webpage at www.explore.gov.ky/traveltime and complete the application form. Travel Time will do the necessary processing and checks and will advise passengers who are cleared for travel to contact Cayman Airways directly for payment and reservation. These are based on demand, and we can see that the groups are working extremely hard to try to meet the repatriation demands. It's also, some of the timing here has been based on requests from parents and children going back to school, and I think if you can look at the August ones and understand clearly that they're centered around a lot of the demands for education. I also would like to just quickly speak about the tourism stipend that was delivered this week. The majority of it, from the outset of the pandemic, government has placed the highest priority on safeguarding the health and well-being of our people. That focus hasn't changed, even though it has been exceedingly hard to watch businesses, especially those in the tourism industry, having to close doors or struggle to wait for the economy, the tourism economy, to pick back up. The government, through the tourism stipend process, has provided first $600 for tourism employees, workers that were not employed anymore. And our program now is a 3-month program, $1,000 each month. And it was the first month sign up was delivered on Wednesday of this week. We still have probably another 400 to send the checks out and the direct deposits, but the first 1,500+ were delivered this week, and we've certainly had quite a bit of acknowledgement that people received them, and they help subsidize and supplement their income. We clearly understand that this is not a replacement of income, but the purpose was to work in a team effort with other government entities that allowed us to make the transition whole for the workers that were displaced because of COVID-19 and the epidemic. I'd also like to make sure that people understand that if they did not get a chance to register, next week there will be another opportunity for registration. It will be announced, the phone numbers and the websites to contact, as was done previously, and then the stipend will continue for the ones that sign up for next month for 3 months as well. So there's not, you didn't miss a month. It's just a lot of unfortunate circumstances that some people weren't able to sign up and they weren't aware of it quick enough, that type of thing. So I think we've allowed for that in a very, very positive way. The reopening. Out of necessity, the Cayman Islands government took the decision to temporarily close our country's airports and ports to commercial passenger flights and cruise vessels until the 31st of August, 2020 at 11:59. While the government continues to take note of the rate of COVID-19 infections in North America, Europe, and other places in the world, we also recognize that keeping our borders closed indefinitely is not feasible, sustainable, and cannot continue from an economic standpoint. Government is aware that with the rate of infection locally standing at less than 1%, the prospect of reopening is a subject of concern to many in our communities, and for good reason. I'd like to give the country the assurance that careful consideration is being given to how best we safely and effectively control the reopening of our borders without putting the health and well-being of our people and future visitors at risk. To this end, the government appointed a Reopening of Borders Committee, RBC, to ensure that input is sought from all of the appropriate agencies, stakeholders, to determine the best way forward for reopening the country when it becomes safe to do so. I want to take a little bit of time with this to really explain the thought process behind it, and I'm sure we'll get a couple questions maybe. The agencies that were included in the committee were each there for specific skill sets and added up to a terrific whole process. The Ministry of District Administration, my ministry, Tourism and Transport, was the lead because of the transport aspect of it, and I chaired the committee. Thank you to the governor and the governor's office who participated at every meeting, and I think they had participation at every presentation. Civil Aviation Authority, the Cayman Islands Airport Authority, Cayman Airways, the Department of Tourism, the Port Authority of the Cayman Islands, the Ministry, Border Control, thank you, Mr. Premier, Ministry of Health, Environment, Culture and Housing, the Minister, thank you, and Dr. Lee, thank you, Health Service Authority, Hazard Management. Now, I listed these agencies to illustrate that government is approaching the reopening of our borders in the same way that we managed our response to the COVID-19 pandemic, and that is by taking into account the most current information and best practices combined with input from all the different entities that have expertise organized in a single group. Each of the entities make a valuable contribution, which I will go into a little bit more. By example, we wanted to understand the global implications of opening our airport, our two airports. The Civil Aviation Authority and the Governor's Office offered that type of expertise because of the direct relationship with ICAO, which is the Civil Aviation Organization, International Civil Aviation Organization. So when the committee met, we were able to understand what every other airport in the world considered best practice and what new techniques were coming out because of COVID-19. The Cayman Islands Airport Authority gave presentations and delivered understanding for us. And the presentation was really tangible because you felt like you could touch what the new norm is going to be. And I give you the example that if you have a room or an airport that was built for 1,000 people and you have social distancing, no longer can 1,000 people fit in that room. You're probably looking at a 40 or 50% under best practice. So we realized then that seating, how it was provided in the lounge, had to be separated. Passengers are allowed to enter the terminal. Family and friends must stay away from the terminal. We got to look at all the policy that they put in place as far as disinfecting the areas they came in, sanitization for hands, luggage, other entities that were being carried, the mandatory use of masks worn prior to entering the airport terminal. We also saw the plexiglass that Border Control put up and made safe, the PPE examples, and temperature checks conducted on passengers arriving repatriation flights. I mentioned this to illustrate that the presentation from the Airports Authority allowed the committee to really understand that this new norm will affect visitors from the time they arrive at the gateway city and board the plane, they trip down through the airport, and then when they get on transport, it's going to be half the number of people on the bus or the taxi that it was before. It's going to be less people in their accommodations wherever they are, and they'll have to realize that type of new norm, so to speak. But the other part of that the committee, I think, really valued and gained knowledge from was that this indicates the change in the cost of what the tourism industry is going to go through. So we are going to be put into a position that our industry will have to be charging more for it to continue to be a profitable industry for the economy of the country. And we had the highest daily rate in the region 120 days ago. So I say that to explain that I believe where we were was the best position the country had ever been in, and the road back to 500,000 stair visitors is following the same success that we'd had before and understanding how we adapt the needs of social distancing and less people to bring us in that same competitive set and the success and the opportunities that we had delivered for the Caymanian people, which we will continue. That brings us to a couple of the other entities that were there that I really need to mention. The Ministry of Health. Nothing will be done by this government without consideration and approval from the Ministry of Health. And that is how the committee approached it. I can say thanks to the complete team between Health Services and the ministry, the time that Dr. Lee put in, Lizette Howell, and the commitments of unending work to make sure the country's protected. So when I say a phased approach to reopening, I would like to make the public understand that we are not going to suddenly throw open our doors, throw caution to the wind, and lose all of the good work that the government, led by Premier and Governor, have done. Instead, with the input and collaboration of the Reopening Borders Committee and stakeholders in tourism, we are considering reopening cautiously and carefully as government has managed and considered every other aspect of our COVID-19 response. Decisions taken will have benefited from the input and expertise of all of the relevant authorities and entities, that safety and security will remain the main drivers behind decision-making. We prefer to err on the side of caution rather than take any shortcuts, and nothing will be implemented without the ultimate approval of the Health Ministry, Health Authority, and Chief Medical Officer. We had 3 different pathways. So the starting point, the minimal risk pathway that we are on today, will continue. And it'll continue until August 31st. The pathway that we have reviewed starting September 1st is still a quarantine pathway, but I would like to walk through it to let you understand how we monitor the opening, and we call it a phased opening over months for the Cayman Islands. And the September is a very, very practical, protective, soft opening for the country. So the first thing in the flow chart is 72 hours before you depart your gateway city coming to the Cayman Islands, you must take a COVID-19 test. And that test has to come back negative. The governing body, so to speak, will be travel time in this initiative. And you will start out by applying online and having a form exactly like you have now that will be filled out with critical questions that are needed to be answered so they can make a decision of whether you'll have permission to travel to the Cayman Islands. And the form will also register, and the review now is looking at an app that you can actually carry with you with all of this information on it as you travel and spend time here. It also will be the monitor for a charge, because there has to be a fee for testing when you come to the Cayman Islands. But the reason we chose this path, because we think it's the safest path, and we believe it also allows us to do some self-isolation, and it allows us to have less of a quarantine period. Now, there have been questions about the technology, the health monitor, the bio button. Dr. Lee has spoke about it. He's had questions earlier today. But the importance of the health monitor is that it allows the government through the Health Ministry and HSA to monitor people who have come here for the period of time that they would normally have had to be put in quarantine or isolation. So you would arrive at the airport, you would go through what I've described before, the social distancing, all the best practices, you would be cleared, and then you would be taken either to an isolation for self-isolation or a quarantine facility. And that would include you getting a health monitor at the airport and being registered that it can be monitored on a dashboard and reported. At that point, your quarantine period would be 5 days instead of 14. And that is handled by, after 5 days, you take a COVID test, and if it is negative, you will be released along with the bio health monitor to spend your other days that the health services will monitor your actual vitals to make sure that you're not moving toward a COVID-19 issue. Right? Once that's completed, then you're released and you are free to do what you want. You've basically been brought into the bubble that at this point in time we say is basically COVID-free. That's the second phase. The third phase, which we reserve the time to monitor this outline and see the results from it. We expect them to be a positive result. We expect the outline to work, and we just want to be very conservative and move in the direction that the next step, if it is quarantine-free, that we do that with all the most knowledge that we could gain from how we've attacked this to start. The important part of this is the monitoring, and it breaks down to a couple different areas. Obviously, the committee itself is going to hand this part of it off to Chief Medical Officer and the Health Ministry. Obviously, the border control is handed off to the Premier's ministry, Mr. Wesley Howard, Mr. Charles Clifford, doing an excellent job. And we continue to work with input from the governor's office and the other entities that I've named and listed for all of the different input that they give in a coordinated manner. So that's an outline. I want to say that we have a lot more work to do at the committee level, and we've tried to show the managing points that this brings out and commit that we will update again as soon as we have the next steps and finalize some of the action items that have to come out of this. But I believe it was important, the government felt it was important, we had a long discussion today in caucus, that we let the country know that the work that has been done, we feel is not at risk with our next step, but we certainly believe that we are announcing that we are on our path back in a very conservative way to open our borders phased and managed.
So we are going to take some questions from the press in a moment, but I guess I
just want
one more. Absolutely. You get
So,
2 more.
Well, no, I just want to make sure, today I gave out in caucus for the caucus to review and give us any changes or questions that they might have. This is our strategic policy that has just been done. It's road back to 500,000 stayover visitors. It's a document that shows what this government has to do for the economy of this country and the tourism industry of this country, and takes advantage of short-term, medium-term, and long term. So next week, this will be coming out, and it will be in the public domain that people can look. We expect on Wednesday to meet with tourism stakeholders and go through all of the different items. So there you go.
Thank you, sir. You've outlined all this very carefully, but I thought it would be helpful for people to just kind of hear from you how you're feeling about where we are right now. You guys worked so hard to get to a certain stage in the tourism product. This happened. How are you and how are the folks around you dealing with the repercussions of that?
I think I'm the luckiest minister, but I'm sure every minister will say that. I have a tremendous team. This country is very fortunate to have the team that it has, led by Chief Officer Strand Bodden and Ms. Rosa Harris, the director, that have worked from the very start with a clear understanding that this is 30% of our gross domestic product. This cannot go away. We'd worked very hard to be the premier destination in the region, and we understand clearly how we got there. We make it easy for people to come and vacation and enjoy. We challenge them to look at 7 Mile Beach, which is the best in the world. We challenge them to enjoy our culinary delights because we're the culinary capital of the Caribbean. But I tell them, don't leave until they spend time with us, the Caymanian people, and we build a 55% repeat base out of how we treat our guests. So last year we did 2.5 million between stayover and cruise. And I would say that there's hundreds of thousands of people at home now thinking about how they can visit the Cayman Islands. And we as a government believe that it was important for us to start telling our story because we have the best story. And how the country has managed the pandemic compared to global management, I think stands up, and we intend to tell the story, and we don't intend to ruin the story at this point when we move into economic benefit. So it's been a lot of work, but the work is just starting. And we have tremendous stakeholders. We have people that call to say, how can we help? And it's been a Caymanian experience of everybody coming together. So I think that kind of summarizes where we are as a team. You know, I say I'm the luckiest minister, but I also have a tremendous government around me, and none of this could be done without the government, without going to caucus, talking about it, getting ideas, getting input. Everyone participates in caucus and gives their thoughts, and we take them on board and we come up with this, and then the committee experience has been run in the same way.
Do you have any sense of who might be willing to come to Cayman bearing the things you've taught, other than family and friends, of course? They will put up with anything for us. But I know you've tried to minimize the challenges for people who want to come visit. But do you have any sense of who might take us up on the offer of coming here, having to deal with kind of the things that we've...
Right. Well, the monitor and the control mechanism is in when you make the application to come, right? And we believe that the important part of the first 30 days is, number one, looking at applications, and number two, understanding that it is going to be more expensive to vacation in Cayman. And we believe that because of where we were and the type of tourists that come and vacation in Cayman, that our 5-star experience has put us in a position that we will offer a boutique property. We'll offer it in a way that it is not too close. The social distancing has been something that has been around because of the size of our properties and the guests that we have. So we think from that standpoint, once we're in the position to make sure people know that we're coming on, if they thought about coming on vacation and they see now Cayman is opening back, we're in their top of mind set, that they're starting to look at us. 2 weeks ago, if they were looking at vacationing in the Caribbean and what they saw was Cayman is closed, we weren't top of mind. They weren't even thinking about us. They wanted to come. They said they're closed. So now we've taken a major step by being able to say we're looking at a phased approach. And we throw the caveat in there that this is all managed to protect the visitors and, most importantly, the people of Cayman. So if numbers go different places, we have the ability to say we will not take people from that area because it's managed with a control point. So, April, I think this is as conservative, but as best practice as we could possibly do. And the committee, again, has been fantastic with the information and coming on board of what they think, and they continue to work.
All right, thank you. So we have a couple of questions from the press, starting with Reshma from the Cayman Compass. Hi, Reshma, you're up.
Sorry, thank you, April. Thank you, Ms. Deputy Premier, for your presentation. Just a couple of points of clarification. Is it possible for you to just explain what exactly is the first step? Is the first step the buying the ticket, and then you move forward from that point, or what does it work? How will that sequencing work for visitors who want to come to Cayman?
So if I'm thinking about coming to the Caribbean on a vacation, I go and I look at different opportunities to travel, and I would go to the tourism sites of all the other countries that I have in mind, and I would ask for travel information. What you should get when you Google that is you should get a directive to go to Travel Time and look at what steps you have to take to come to Cayman. And then the first step would be the form that you fill out, which is going to demand from you a COVID test. So your starting point is that you take a test and it comes back negative. So once it comes back negative, then you're in the set to be given permission to come to Cayman. This is going to have priorities, obviously, for this 30-day period, which number one will be our Caymanians who are away for medical reasons. It's going to be young people who have gone to school or getting up to school. It's going to be parents that have gone up with their children to make sure they're in school. And the other part of it is looking at a number that we feel we can accommodate through the airport and through the other transportation issues that they'll have when they arrive. So I think what we're doing is allowing ourselves to see how this monitoring and reopening can be managed in the best possible way. What we have found, and I need to say this in the right way, but regional islands who have opened have experienced spikes in COVID. And they've had to make decisions that they didn't want to make by closing some of the gateways and changing some of the ways they were doing business. We don't want that to happen here, and some people might say this is a little conservative on one side, but with the guidance of the committee and what we believe that we can manage this through the different checkpoints, that we will not have to change our way forward.
Okay, so you mentioned a number that the government would be comfortable with. Can you share that number, unless you've already shared it, and please forgive me if I've missed that.
No.
What is the number that you're looking at that would be okay for Cayman to manage the transportation inside the airport?
So let me explain it to you this way. The way we look at this is we consider short-term 6 months. And the policies that we put in place is pushing us to a 6-month opening policy. We know that at the end of 6 months, we should have a lot more people on island than we're going to have in September, October, so to speak. But what we're going to gain from that soft phased opening is we look at a percentage and say we did 500,000 last year, 300,000 in that peak 6-month period. If we can do 150,000 people in that period of time with the other incentives and initiatives we have in place, we believe we're on a pathway back to success with our tourism product.
Okay, so we've had, I don't know if you've seen it, but we've been running a poll on the Compass, and there's been a great divide basically on opening the borders, not opening the borders. And even during your presentation, we've had comments coming in about Cayman, basically opening itself to risk for further cases. Is there any contemplation from the government on, say, limiting by country who can come into the Cayman Islands, or is it going to be open to anyone?
Dr. Lee, do you want to take that, or I can? I will say there absolutely will be monitoring of where people come from. And in the same way that other countries have managed their gateways and said we're not taking from a very high COVID outbreak or spike area, our policy from government would be the same thing. But Dr. Lee is here.
Hi, Reshma. So, yeah, I think that just with any policy that the government is developing, it will be developed based on facts. We have had a lot of assistance from Public Health England in considering where people might come from and the different risks. We are currently in the process of drilling down even more to look at the places people fly from. We have to bear in mind that if somebody wants to get here, or if groups of people want to get here, they're just going to get on a plane and get to the place that they're allowed to join the flight from. So there is a limit to the usefulness of spending too much time on this, because so our protections really need to be fairly solid when people arrive here.
Okay. So we are still on track for the September 1st reopening, and if we are still on track, the phased approach that you've discussed seems like there's going to be a lot more hands needed on deck. Are you going to be increasing the capacity at the airport when it comes to the Customs and Border personnel, the airport staff, those who will be doing the sanitization efforts? Can you speak to me a little about that aspect of the reopening of the borders?
The consideration that we have to understand is on a Saturday and Sunday afternoon, the airport was completely full. That can't happen anymore. So we're going to have to control how flights are allowed to arrive and how many people are allowed to go in to the airport itself. So that in the same way that we look at how we approve people to come here, it's going to also have to be de-peaking the arrival times of the planes, that we don't find ourselves with an unbearable situation in the middle of the day. So I use that to answer your question. The number of people that we used to have because we were bringing 5,000 people in on a Saturday, at this point, that can't happen again. We can't bring that number of people in. So again, this is a slow growth out. It's a phased, and I believe that one of the reasons that some of the islands had the issues is because their opening was not a phased opening. Their opening was not like this. Their opening was anybody that wants to come, sign, and you see the different. We have been able to look and see what we considered the better practices that were put in place.
DP, if you don't mind, my phone is blowing up over here too. I just need to make this clear, if I can, that this is, as the Deputy Premier has said, going to be a phased, slow opening, not a general reopening to all commercial traffic as we have come to know it. And it is self-regulating in this way. As the Deputy Premier has explained, in order to come, you've got to do a COVID-19 test 72 hours before your departure to the Cayman Islands. That test has got to have a negative result. Once you arrive here and you go through customs and immigration, you get a bio button, which will monitor your general health, your vitals, your respiration, your temperature, the full range of things that Dr. Lee has explained. You then go into essentially monitored self-isolation for a period of 5 days, after which another COVID-19 test will be done in Cayman. And it is only after that that you, a negative result from that you are allowed essentially free roam in the Cayman Islands, even though you will be required to retain the bio button for, I think, another 6 days, so that even beyond that point, you'll still be monitored. So the point of this is, when you realize that the average stay of visitors who come by plane to the Cayman Islands is 4 or 5 days, don't expect that we're going to get a great take-up from that category of visitor in these initial months. What we're going to get, we believe, are significant number of local people that the Deputy Premier referred to, who will come back home to Cayman and be allowed to utilize this process rather than going to a government-run quarantine facility, as well as persons who stay in Cayman for longer periods, people who own second homes here, people who spend their summers or whatever in Cayman. These, we think, are going to be the initial categories of people who will come. The numbers, we believe, will be relatively small, which will allow us to monitor them better, allow us to work out whatever kinks there are in the protocols we are putting into place, and gear ourselves up for more visitors over time. I do hope that helps. As I said, my phone was blowing up here as well about what this phased reopening actually involves. But just let me say, as the Deputy Premier has said, there is no way we are going to risk the tremendous success we have by yielding, regardless of what the polls say or not say. We have not managed this pandemic based on public opinion, because had we done so, we would not be in this place now. We are following the science, seeking to utilize all technology that there is available, and applying good old Caymanian common sense to the measures we are seeking to put in place.
Thank you for that, Premier. I appreciate that. Just to go back to my question on the dates, do you have the dates for these phased reopenings that you can share with us? So the borders are going to unlock on the 1st of September. How are the phases going to run?
We're going to send you out a press release and tell you that September 1st will be the first phase. And I think I said earlier, that's going to give us the opportunity to monitor. And we put the caveat in that if all of the numbers come back the way we expect them to come back, then we will look at October to see how we change. The same way the levels have been changed over the last 4 months, that with success, more openings take place, is the same manner and policy that we're going to have in the opening of the border.
Okay, great. Thank you, Mr. Kirkconnell, for that. And I'm going to hand over to Wendy because I know she has a couple of questions as well. Just for the process with travel time, because we've had, of course, tourists are excited to come back as well. With the application process, once the negative test is received, does that test have to be then sent back to travel time? And that's how that sequence is going to go from my test, I send it to travel time, they send me back, okay, now you get the green light, you can book your ticket and come?
Travel time is going to be the one that receives the test from you, and they're the ones that are going to be that they basically authorize that it's valid, and it's done by a lab that is accepted, and then they will provide you with a document that authorizes you entry.
Okay, so with travel time managing this tourism aspect, they are also managing the evacuation flights. How are you going to balance those two features, or they no longer have to deal with evacuation flights because the borders are open now?
We believe that it's a manageable issue. Obviously, this is very fluid and moving very quickly. So if you give us time in our press release, we will identify that as well. They feel comfortable. The meetings took place yesterday, and they felt comfortable that they had the ability to manage this. So we expect them to do that. Everything else that we've asked anybody from government or private sector on Team Cayman in moving forward with COVID-19, everybody's been very reactive and competent in what they've committed to do.
Okay, great, thank you. I do have questions for the panel, April, but I will give way for my colleagues to ask their questions to the Deputy Premier.
Thank you very much, Reshma. We go now to Wendy Ledger of CNS. Wendy, just give me a moment to click the switch here and get you up. We should be able to hear you now.
Okay, is that okay?
Yep, sounds good.
Right, great, thank you. My first question for the Tourism Minister, how are the people going to get here? Have we already discussed airlines coming back, or will this all be Cayman Airways, or will it be private jets?
Our first part of the reopening, we've identified today the September program, and the September program continues to use repatriation flights, and it continues to use the ability of travel time to monitor the requests to come in. So at the September level, it's a Cayman Airway offering, and it's a Cayman Airway offering on repatriation flights as well, that they go up northbound and in other directions with repatriation, and they have been bringing back medical and local people. So there will be, Wendy, a priority list of people who come back in that time period.
Okay. So at the moment, it's effectively still the repatriation flights. So it'll be the British Airways flight, the Cayman Airways flight, or any private flights that are organised. We haven't discussed anything with any American Airlines yet,
that is correct.
Or any other. Okay,
that is
great.
correct.
The second question I have regards the monitoring phase. After the tourists or visitors arrive, and they've gone through customs here, and they go to their accommodation, be it their own home, the Ritz, or another hotel. What is, besides having the biomonitor, what will monitor that isolation to prevent them going to Foster's or a bar or whatever, whilst we don't know whether they've got the virus or not, or they could still be incubating the virus?
Yeah. In what we have been reviewing and looking at and presented with is geofencing is part of the health monitor, and that would,
so tagging.
That would give you the ability from the monitor that you have a space, and let's say that space is a condominium or your hotel room, and when you go outside of that fenced area, a red alert comes on that public health would be notified.
Okay, cool. So like an electronic tag.
Electronic tag.
Correct. Yeah.
Give or take.
Yeah. Okay, great. Also, when you say that we're going to avoid allowing people to come back from spike areas, clearly Florida is a spike area, and that would be where, if we're going to have American guests coming back, that would be the airport that they're coming through. So how do we deal with that?
I'm going to ask Dr. Lee to answer that, because I hate to put him on the spot, but he is the expertise in that.
Hi, Wendy. I mean, clearly that's the million-dollar question as to how do we do that. And I think you also have to bear in mind the number of people that are actually positive in Florida. Although the numbers are really high, the actual numbers of the population are enormous. So the percentage of people who are actually infected is in fact very small. That's not what the news would lead you to believe. You'd think the whole of Florida has got COVID. But if you actually look, for example, at the surveys that have been done to see what the percentage of people that is positive in a community, it's probably somewhere between 2 and 5%. And it's those figures that we need to concentrate on when we make the decisions, and those figures that are available at a global level through WHO and so on, which I'll be asking PHE's assistance for in guiding us as to what we do exactly. In many of the countries that are actually, you'd think they have very florid infection rates, the actual people infected at any one time is probably at around 2%. That's the figures that we're being advised, that is the people who are actually infected. So, and those people, many of them will be symptomatic and they shouldn't be traveling and will test positive for COVID. All of these facts will need to be taken into account when making the decisions, but how I opened this is with the actual numbers of people at the current time that are infected is not as huge as you might immediately think, even though the figures are clearly shocking.
Okay, thank you, Dr. Lee. My next question would be, when we move into October, what sort of monitor, will it be the same type of monitoring that we're going to keep this like electronic tagging on visitors?
That is the current view. We really,
right,
as Deputy Premier has said, the initial period, this trial period, as with all of the countries across the region, it's a trial period, open the borders, and we will be learning very quickly what actually happens. But our intention is that, yes, the monitor would continue, because actually, if it really does give us the security that we hope it does, then it'll put us in a very different position with that constant 24-hour analysis of your heart rate, pulse, and respiratory rate. Those three things are really the three facts of the physiology of your body that will tell you if you have any infectious process going on. And every medical student will know that as you get an infection, your temperature begins to rise. It rises because you are shivering, your muscles are working. That causes an increased oxygen demand, which causes your heart rate to increase, to pass the oxygen around faster, take the oxygen away from the lungs and to supply it to the tissues. So those three factors will tell you if you've got an infectious process on board. And we hope we'll therefore demonstrate. Say again, sorry, Wendy.
Obviously, there's been an awful lot of asymptomatic people with this virus who we know can still transmit it.
Yeah,
so I mean, how will it help with that?
This particular, I mean, if you're monitoring people incredibly intensively, you're very likely to pick up what we call the pauci-symptomatic people, the people with very few symptoms. And we actually believe that the numbers of truly asymptomatic people are relatively low as a proportion of the people who are pauci-symptomatic, in that they had a day or so of feeling a bit rough, they weren't quite sure, the symptoms passed off. But if you're intensively monitoring people, you should be able to pick up that too.
Right.
It might not be the case. This is, we are in relatively uncharted waters. We're not in uncharted waters with regards to this device being able to monitor bodily physiological measurements. We know it can do that. It's FDA approved to do that. It's been used widely for that. To use it in this particular circumstance is really an addition to what other countries are doing. So other countries are opening their borders with PCR testing before and after. We're doing that, but we're adding this extra level of biosecurity, of biosurveillance, as well as the ability, as we've mentioned to you, of geofencing people when they're in a period of isolation. So we're having safety at a lot of different levels, and the combination is going to very much improve our ability to welcome travellers back to the islands. It's not just any one thing in particular. I know people like to focus on the device, but it's not just the one. It's all of the different facets that we're putting together.
Can I just clarify, is the bio device also the geo surveillance device, or are they going to be two separate things that tourists are going to have to wear?
It's sort of a combination thing, and with time, we'll be able to teach you more and have a more extended session on what the final decisions are. But it's a combination of a number of different factors. So the bio device can talk by Bluetooth to a number of different things. It can talk to a mobile phone, whether it's your mobile phone or somebody else's mobile phone, and it can also talk to a hub. They can also talk to each other. So you can soon see that by talking to so many different devices, you build up a network of where any one individual bio device will be. If you have, for example, a hotel with, I don't know, 600 people in it and 100 people are wearing those bio devices, they're all interacting with each other, so you can fairly quickly tell where somebody's been and also when they've left that place.
Right, okay, so they make contact tracing easy.
Contact tracing is a different matter. We were talking about geofencing just now. Contact tracing is actually more about who they've been in contact with. You're quite right that the contact tracing, was I next to bio button A for longer than 15 minutes at 1 meter or whatever? Yes, absolutely, it'll help that. Anybody's phone can also download an app related to this biological infrastructure, and that can also enable the Apple Google API to provide the contact tracing that we've all heard about on the news, so that uses that in addition to the other features that I've talked about.
Okay. This question is probably for the Minister. Minister, you talked earlier about it's going to be more expensive to come to the Cayman Islands effectively. Is that because this monitoring will add additional costs, which are going to be passed on, presumably, to the visitor, and that this is not all of these bio buttons that we're going to have to buy, the people that will monitor it, the extra staff that will be needed to keep a record of temperatures going up and down, people breaking the geofencing, all of this huge army of people that it sounds like we're going to need. How are we going to bill the tourists for that to protect the public purse?
I think your major concern in the question is the actual cost of it, and if it will give us an issue with building our tourism industry. Is that the correct assumption, Wendy?
No, I was just asking, because you spoke earlier, it's going to be more expensive to come to Cayman. And now, obviously, we're hearing this bio button and the monitoring device. That it's not, if we're giving every single visitor a button and then having to monitor every single visitor extensively, that is not going to come cheap. We're going to have to presumably employ extra people. So how do we cover these new costs that government will incur from, how do we recover that from the visitor?
Right. No. So a couple things with that. Number one, if we're going to talk about the tourism visitor, we believe that the tourism visitor is prepared to absorb a couple $100 to the trade-off being that they're coming to what has been the safest island in the region, and the safety and security of their family on vacation is something that they're extremely willing and ready to pay for. We also control that by the mechanism, again, that when you register to come to the Cayman Islands, you're also at that point going to pay a registration fee. So that is going to be the revenue stream to pay for not only the use of the button, but also the COVID tests while you're here.
Okay. So it will cover the cost of extra staff, the button, the geosurveillance, and the various tests that they'll need.
Yes, ma'am.
And it'll be a flat fee per head.
Yes, ma'am.
Okay, thank you. Appreciate that. I understand it now. April, I have some more questions for the panel, but I think Greshma wants to get in, so
yes,
I'm not sure what our timeline is.
Yeah, we are running short on time, but I will come back to both of you. Just bear in mind that I may cut you off at a certain point when I get the look.
Cool.
And then a couple of things that just I think came in from the public, some of which I think you've addressed. One person wanted to know if there were kind of hard and fast caps on the numbers of people we're looking at through this first 30 days. So is there a limit of how many people we'll be allowing to come?
I would say that yes, that is correct, and it's going to be revolving around the flights that we put in place for repatriation. You know, what has taken place previously is that we have repatriation flight and we have an air bridge. And the air bridge allows us to monitor, but we also have to quarantine. So we're limited in the number of people who can arrive because of quarantine. What this does is allow us to have more people arrive that we've already pre-tested, and we are now, instead of doing 14 days, down to 5 days as far as the quarantine. So that's a mathematical equation that they work through at travel time, and yes, there is a number that they will come up with.
So there's no hard and fast limit. We're allowing 50 people, you know, in September. There are a few variables that you're factoring in along the way.
Correct.
Capacity, flights, demand, et cetera. Okay. And I'm coming, Reshma, the other one was probably a silly question, but it was mine. How you kind of explain how we were able to go from we needed this longer quarantine period to this much shorter quarantine period? That may be a Dr. Lee question, to be honest, but it would be helpful if we could kind of explain that.
Firstly, I would want to make sure that people don't confuse the incubation period of the disease with the period we need to restrict people after they've been shown to be positive. They are two separate periods. But I think that, April, you're asking about the incubation period, which is the 14 days during which you may become positive for COVID-19. Fairly extensive work looking into this has shown that if you do 2 PCR tests a given time apart, you will pick up more and more people that are likely, that are possibly likely to be positive. And that in doing so, you're buying yourself security by spreading the time between 2 tests rather than having a single test. A single test is relatively poor at picking up somebody who may be positive, who may be going on to have COVID-19 as they may become positive a little later. The reason that we've chosen this 8-day period, which is a 72-hour period before people board the plane, and then the 5-day period afterwards, is that we believe that you're likely to pick up around 93% of people who would be positive, who can then be isolated or advised not to travel. That's the reason for the change in the period. However, the biomonitoring and also clearly the ability for people to report symptoms and to attend to local healthcare practitioners continues to exist at any time, but the biomonitoring will go on for the full 14-day period.
Thank you. I think that helps a great deal. All right, now to Reshma.
Thank you, April. Thank you, Dr. Lee, for that. Now, I've had a couple of questions come in relation to, again, the process and the procedure. Just jumping off what Wendy was tackling, do we have these bio devices on island, or how soon do we expect them, and in what quantities will we be ordering them?
If you could allow us some time to give you that answer, because we're just working through this now of how many we're going to need and when they will be arriving. So I think that information will be available next week sometime.
Okay. In terms of the process for those devices, though, will you receive that device, say, at your gateway in Miami before you arrive to Cayman, or will you be receiving that upon arrival at the airport?
Didn't I just say that? We're going to reserve the right to answer that next week as well. And the reason being is this, because in the same way that we've been able to collectively make decisions, I think without fear of being contradicted, Dr. Lee will have a big say in where those buttons are given out. But it also, if we decide it's going to be in Miami, that's something that we'll have to talk to the airline partners about. Department of Tourism will be involved and other stakeholders. So we will get you those answers, but I would really appreciate your patience to let us get this program in place. We're talking about 6 weeks from now, so there's a lot of things that we need to put in place and be able to announce in a managed way.
Okay, fair enough, Mr. Kirkconnell. I'll try and balance that. Just continuing with I'm sorry, I know you've said it before, but the process, and there's some confusion in relation to that permission that is granted, because naturally questions like the Premier said, his phone is blowing up. Everything I have is blowing up as well, from Facebook to Twitter to WhatsApp. But that particular process of permission, now you're saying that you need to get the negative test before you get permission to come on island. But of course, people will naturally want to book tickets in advance. Is it that they will have to book their ticket 3 days before they travel? Is that what the process is going to look like? Or is that still part of the mechanics that is being worked out?
Well, the test is 72 hours pre-departure, right? And based on what happens in September with availability, remember, it's the slowest time of the year from a tourism standpoint and a travel standpoint. It should give the ability that once they finish, and this is, I will tell you that this pre-test is not uncommon in our region. If you look at quite a few of the other islands, this is one of the prerequisites that they've started with. I can't tell you that they all started with this when they began to open up, but a lot of them have landed there now. So from a competitive set as Destination Cayman, we are in the same area as what our competitors are doing. So you call, you get the application, the form is filled out, and you support that with your COVID test, and then you start engaging the conversation.
Okay. I've got questions coming in asking about penalties. So as the process goes along, are there any penalties that is being contemplated for people who may remove the device or in some way breach the agreement that they make when they enter into the islands, and what those penalties are going to look like?
Yes, Reshma, all of those things will be in the new regulations which will govern this aspect of it. As the Deputy Premier has said, this is 6 weeks out. So we have a lot of work to do on the mechanics of how all of this is going to work. So the purpose of today's press conference and this announcement really was to start to prepare the country and the people who want to come here for what the process is going to look like in broad strokes. But the mechanics and those nitty-gritty details which matter so much are things that are still being refined.
Thank you very much, Premier. In that case, I'll move on to some elementary questions that were prior to the big announcement that took over. In terms of the social distancing protocols and the restrictions that you've announced that have been lifted from Sunday, I've had questions come in relation to church gatherings, if the 3 feet distance will apply to them, and also in relation to that, offices, what's the social distancing length going to be? Will it remain at 6 feet, 3 feet? Were there any changes to that?
So what we are well aware, because we in particular me move around, that these things are now being observed more in the breach than in the actual application. The social distancing I'm speaking of. But the advice remains clear. In controlled environments, sitting around a table, having a meal, that sort of thing, 3 feet is now acceptable. But if you're going into Foster's or Kirk's or wherever else it is that you're going, which is unsupervised in a real sense, the advice still is to remain 2 meters or 6 feet away from other people that are not part of your household or people that you are closely associated with. So good common sense is really what needs to guide, as I've said all along, where we are now, rather than, expecting the distancing police to be following people around and giving out tickets.
I think that's what a lot of people are concerned about. But in particular with the offices, though. Sorry, if you went, we still.
Yeah, well, in offices, the advice is, except when you are sitting at your desk, you should be wearing a mask if you are moving around in your office.
So Reshma, with my eye on the clock, if you have another question, you can ask it, but I really need to move to Wendy next because we are going to have to wrap up here shortly.
Okay, thank you, April. I'm going to have to ask this final question because I've gotten this quite a few times now, and if I don't ask it, I'm sure I'm going to get a tongue lashing. But baptisms, is it okay to get baptized, or are we going to wait for level 1 to give baptisms the green light?
I must confess, I don't know the answer to that one.
All right.
Okay. Thank you.
Thank you, Reshma. All right. Let's go now to Wendy Ledger. Wendy, you're up.
Thanks, April. I have only one question. It's just because we still had some people asking about this, and we got some more information today to say that people are still not covered. I understand that the health minister has sorted the majority of the issue regarding the benefit system. The two questions that have arisen today are, will those people that lost coverage and therefore had to pay for their own, or many of them now are in a position they owe money to the HSA for treatment that they received because they lost coverage? And also, given that we are going through this very phased opening of tourism, which appears that people in certainly the lower end of the pay bracket won't be going back to work necessarily, is there any consideration to extending this benefits package for a few more months?
So Wendy, that's a question for Minister Seymour. I just need to give him a moment to make his way to the podium.
Yeah, of course. Sorry, I forgot he got moved.
Thank you very much. Minister Seymour, thank you.
Thank you for the question, Wendy. Obviously, as you said, we tried to solve as much as we could in terms of questions from the public. This program in itself was listed for 3 months, the months of April, May, and June. And if we have persons who, as been reported to me by the HIC, that it's probably only one company who defaulted on its agreement with the government. If we have persons out there who have pending hospital bills with the HSA or otherwise, which we only heard of one case, I would ask them to contact the HIC, hic@gov.ky, and report this case, and as a case-by-case basis, this will be considered.
Thank you for that. And what about extending the program, given that it looks like tourism is not really going to be up and running until much later in the year? So we're still going to have a lot of people who are going to be in this furloughed position where their job will exist down the line, but it doesn't exist now and they're not being paid.
Yeah, that is one of the considerations of the government. We're having discussions, and should we go ahead in this same fashion as we saw, we had some hiccups with the way that we had approached it in this 3 months segment. So caucus is discussing how we move forward, still recognizing that we have this problem out there and that persons are still unemployed, and the last thing that the government wants is for persons to be uncovered during a pandemic.
Right. Okay. Thanks for that, Minister. Thank you, April.
All right, thank you very much, Wendy. And just one quick other question from the public before we wrap up. Folks asked about security. The information that we're gathering, of course, is very confidential information. Are there assurances that we're going to keep people's private information private, I think? They're really just concerned about the fact that we're now gathering data that perhaps we've never gathered from people before. Dr. Lee?
Thank you, April. Yes, I think that's a major concern for all of us. We want to keep the information as secure and as private as it needs to be. That, again, I'm sorry, is one of the issues that we need to iron out, as they say. There is some aspects of this where we consider that the information that we're gathering is merely surveillance and is not necessarily medical. On the other hand, it is medical data. Who owns the information? That needs to be clarified. Is it, when it's sitting in the cloud, is this owned by Cayman government, or is it owned by somebody else, or is it owned by public health? Who has access to information? Clearly, these are all matters that are high on our agenda, and we will be consulting extensively both with the Information Commissioner and with the Attorney General in order that we make the right approach. Ideally, we want to be able to give all the information back to whoever it was if they want it and not keep it, but that would be my ideal way. Whether that's actually possible or not, I don't really know. Because we only need it for this very defined purpose, and then we don't need it anymore.
And of course, we would be guided by the data protection law as well. Absolutely. But nonetheless, as you pointed out, things have to be discussed and vetted and figured out in the scheme of things. Thank you very much, Dr. Lee. Are there any final comments?
April, as a tourism minister, I don't want to miss the chance to remind people that staycations are up and running, and Cayman Brac and Little Cayman are in that set of staycations, and people are really enjoying it and reintroducing themselves to Caymankind and the three islands. I also want to shout out to Miss Lurley Scott. It's her 93rd birthday yesterday, and she's the matriarch of Spot Bay, so we're very pleased to wish her a happy birthday.
To her as well. Mr. Premier, Your Excellency.
Yes, thank you, Wes. I just want to make an announcement. I think some people anyhow should be happy about this. The Cayman Islands Coast Guard is now hiring, and we have space for 10 recruits. We're seeking Caymanians between the age of 18 and 35. For those of you interested, there's more details on jobs.gov.ky. And I also have a couple of birthday shout-outs which I need to make as well. Otherwise, I'll be in trouble.
Take your time.
Right. So I guess I had Ms. Lurley, but Deputy Premier has dealt with that. And then I have a happy birthday to an extraordinary little girl, Flynn Scott, who turns 11 today from the Spot Bay Committee in Cayman Brac. And a belated happy birthday to my Chief of Staff's daughter, Sarah Tatum, whose birthday was last weekend. I hope I get some brownie points for that.
You may or may not, is the case. And gentlemen, one quick question from the press cumulatively. Any word on when there will be another briefing or update in order to follow up on some of the things that we talked about today?
I don't know. Perhaps next week, but we don't really need the daily briefings that we had before. And so we are trying to ensure that when we do have one of these briefings, we do have some real solid information to communicate. So we'll see what develops over the course of this week coming. We've been working really hard this week, and we've been having 2 and 3 caucuses a week for the last few weeks because we have a whole range of issues, not just COVID-19 related, that we are grappling with. And of course, the following week we're in the House. So I think we'll try to fit one in sometime next week, probably towards the end of the week when hopefully we would have amassed a bit more information.
And I think the intention is to digest some of what's been said today and then be able to come back with you with questions rather than us all bombarding you individually from our media houses. So thank you very much for the consideration. And thank you all, gentlemen. Thank you. That does it for us. You can always watch the entire proceedings online on the CIG TV YouTube channel. Thank you very much.